We have a couple of questions from the audience, Mark. I would say to the speakers, the first one is congratulations for the first panel. It is possible to say that the pandemic death could be avoided with better treatment of NCD people. So I pose perhaps some of you would like to answer, perhaps.
Yeah, I can take that one. As I said, really, in the last few slides, we know who's going to do badly with diabetes in hospital, and those people with poorer control, other complications, overweight. And we can do something about trying to maintain good health, because most people with diabetes are completely healthy. It's just a nuisance. Well, Mark would probably say it's more than a nuisance, but it's very difficult to live with a chronic condition that needs daily attention or hourly attention. So looking after yourself, and it's the same with heart disease, taking your medications, and it's the same with chronic renal failure, for example. Being careful. For our patients with transplants, need to be very careful because they're immunosuppressed and therefore need to really keep away from people they don't know. As we say in England, within a bubble. I've learned a lot of new terms during this pandemic, and that's one of them. Mm-hmm. I'm sure they say the same in the United States. They speak American English, though.
Thank you very much. Dr. Bath or Ms. Lane, anything to add regarding the question?
I could add a little bit just to take it from a different angle, which is less clinical and more systemic. I think there's a lot that isn't really one versus the other, one before the other, but across, and just again, drawing on some of the experiences as we're listening and learning, what both, no matter the disease, in the end, if we're trying to stay healthy and survive through this time, there are things that we're learning in the NCD response and frankly, in the pandemic emergency about how to move quickly and where is support needed and who needs to be heard. And I think there's a way to be able to elevate that so that there are fewer deaths in the future. So I do think that getting a bit into the movement side of this and the system side of this while we're looking at the clinical side of this will get us to the end. And again, this audience and the power of advocacy that comes forward from it, I would bring the question back to the audience on how do we bring it from that systemic and justice and advocacy view.
Thank you. Ms. Land, you want to add?
I'll just add something very quickly, building on what we just heard. I do think that given that we do know a lot of the science and what needs to be done, it really is about this building of the movement and making sure that the voices that we need to hear are the ones that are out there speaking. And I think, there's a question later about people living with NCDs at the decision table. And I think it relates to that point in terms of we want to hear from those who know what's happening, those who are experiencing the impact of this in their daily lives. And I think raising those voices to a place where key decision makers and the public are really hearing those voices and understanding is going to really help move the ball along in this effort. And again, this sort of convergence of NCDs, COVID, social inequities and injustices all coming together, we're really, I think, at a critical moment where we can try to leverage all of that momentum where people are identifying with these critical issues from where they sit, but coming together to really bring the issues to the forefront of the decision-making table. So just.
Yeah, you start touching upon responding the second questions that comes from Guy Fons from WHO. He said, in general terms, cost-effective, high-impact policies, frameworks, and guidance is readily available. However, the bottleneck is translating these resources into contextual action at the national and subnational levels. To address the bottleneck, we also need to consider the following: securing seats for people living with NCD at the decision table. We also need to consider including NCD services in primary healthcare in all countries, expand benefit package for UHC to include NCDs, constructive dialogues and partnerships with the private sector on meaningful, effective joint efforts. And last but not least, enhance domestic financing for NCDs that does not necessarily and always translate into more funds, but optimization of national budgets. So here comes the question. How can no government stakeholders better support these trigger points? Perhaps, Shulin, if you want to start with.
Sure, thank you. I think this is definitely an area where civil society, academia, individuals, and organizations have a key role to play. And I think what we've seen in public health advocacy, sort of some of the most effective ways to raise these issues kind of go along the line of three main steps in an effort. And one is really exposing what is the drama, right? So civil society or public speakers, people need to get out there and expose the drama to the public in ways that are understandable. Kind of, so let's take COVID for an example, you know, and the US and Brazil. They're the first and second nations with the highest death toll in the US. Why? But they're powerhouse countries. And why are they having trouble containing this virus when they have the resources to address them? That's sort of taking the issue and saying, this is a problem, right? And then figure out, okay, why is it a problem? And people will have different opinions about that. But one angle I'll take is, you know, governments are responsible to guard and protect the lives of their citizens. And then when governments are not doing that, it's our responsibility as active advocates, citizens, to call them to account and to really challenge what they're doing. And then, but to do so in a way where we're providing the solutions, right? So we're calling out the actors for not taking appropriate action, but saying, look, you're downplaying this virus, you're putting misinformation out there. And then say, but we have information that works, right? We know that wearing masks, washing hands, social distancing works, and encourage sort of those messages to come out from credible actors, from people who are really experiencing the negative impacts of the policies that are or aren't in place, and then encourage that coordination and highlight areas where it's working. And it's tough to do, but when we have momentum like we do now, I think there are a lot of actors that can come together to sort of push the government towards the right actions.
Thank you. Dr. Bath or Dr. Bolton, any addition to the response?
I would just say that this is a time not to get distracted. And it's very important to not to come together on it, right? So there's so many examples from the NCD side as well as the COVID side, and if done very carefully and well, it won't be one or the other. It's to come in together, and I think that we do have that opportunity now. And you know, I heard this the other day. No one starts their day wanting to do the wrong thing. And that includes our government officials. They don't start the day wanting to do that. So how to help everyone see what the right thing can be, I think would be, is incumbent on us. I completely agree with what Julia is saying.
And part of that question referred to primary care. And I think certainly in diabetes, 80 to 90% of patients in this country and in many countries are not looked after in clinics and hospitals. They're looked after in primary care. And having good services in primary care, not only medical doctors, but healthcare professionals. The diabetes nurse, we've dedicated this year to the year of the diabetes nurse for World Diabetes Day theme, because the nurse is key to success in education and being consistency of care. So primary care is vital in all non-communicable diseases, hypertension, asthma, heart disease, and so on. Sure.
Thank you. I have a question, Dr. Band, for you. It's from Ronaldo Pineda Weisberg. Dr. Bolton, among the criteria about screening programs, there is one point stating that we should have treatment facilities available for all diagnosed people. How do you think we can address this major problem of health inequities in developing countries to provide these facilities instead of only screening?
Well, at the IDF, as Mark is one of our vice presidents, as he well knows too, we're very active in developing countries in promoting education. And this year we have a diabetes school, and part of it is education of healthcare professionals in developing countries. And we're also working with governments. I know there are foundations. I've just been reviewing a grant for a big grant which is going to help type 1 diabetes in developing countries in sub-Saharan Africa and the Middle East, working with poorer countries in the Middle East, really working with governments to help them develop the right services in primary and secondary care for people with diabetes. So it's really working with the governments, but also the healthcare professionals. And I think what we can do as a society is promote diabetes as something that can be prevented. And governments listen to costs, and the costs of diabetes are horrendous for the late complications, which are entirely preventable in most cases. Nothing's preventable in everybody, in most cases. So it's understanding diabetes as a problem, heart disease as a problem, that prevention can work, a little bit of expense now for long-term expenditure, savings rather, a little bit of current expenditure for long-term savings. Sadly, it doesn't always occur in the government who are looking for the next 4 years in re-election. But we've got to help there in early expenditure and a bit of education. Provision of the medications for diabetes aren't expensive in developing countries. The agents such as metformin, sulfonylureas, many insulins, biosimilars are available, not expensive, and the governments can realize this. So it's education of politicians and healthcare professionals.
Sure, thank you. Mark, can we continue with the questions? We still have time?
Yes, please. We still have some more minutes.
Okay. I have a question to, I don't see any other question coming from the, if I'm wrong, from the participants. And I have a question to all of you speakers. My question is, it's clear, at least to me and perhaps to many other colleagues in this webinar, that the status quo is not an option. And we need to accelerate transformational changes to address the NCD epidemic. How do you see the role of the private sector, and in the case of Ms. Lane, the civil society, in providing and achieving this equitable and sustainable transformation for us to address the NCD epidemic? Who would like to address these questions among yourselves?
I can give an
Perhaps.
angle on it. Now, I think it's a great question. And I think in starting it, we have to recognize that the private sector is complex. It's not one thing. It includes everything from the complexity of private financing, which, I've already walked through, but also it goes all the way through to civil society. Mm-hmm. And so the kind of bubble bursting that you're discussing, right? And what is it going to take? I think it requires posing the question differently. It isn't the sectors alone. It's how are we really going to change the way that we take on intersectionality and intersectorality in being able to move forward. And doing that, I think from the corporate sector view, one part of the private sector, and within that, from the corporate foundation view, there are a lot of things that are great things to accelerate. We move with speed, right? We move quickly to make sure that not only are outcomes rising, but pride is rising, right? Right now, more than ever, we see the importance of communities and of which we all as employees, no matter what sector, are a part of. We all want to have a hand in the solution, which I think those three things alone are anchored in any advocacy response: speed, clarity on the result and the outcome, and authenticity of knowing that we are all part of it, and that we all have a seat at the table. So I do think that some of it is posing the question differently and recognizing what's the puzzle piece that we all have that we need to come together on, and then clarifying that this moment requires speed and perspective in a very different way. And some of that I think requires all of us getting a little more comfortable with letting our old frameworks go, including those of us trained in public health, trained in whatever. It's so hard to let that go, right? We work so hard for it. But what's happening now relies a little bit on that, but it's relying on a whole lot of other things. We would have never thought Zoom is how we would have been together a year ago. If we hung on to the things from the past, we wouldn't be here now. So those are just a few things that I would think of.
Indeed, thank you very much. Anyone would like to add? There is another question coming, and I would read after hearing your thoughts.
Well, I could just add, I mean, I think to the point of, breaking status quo is always in many ways about being brave and taking steps that we're maybe don't feel ready to take. But I think that the points made earlier about sort of starting the day and starting with the assumption that people do want to make a difference and people do want to figure out how to address these issues. And we're certainly seeing that a lot lately. And I maybe not getting bogged down in what might be the best way forward, because we can hold ourselves up sometimes if we're trying to find the perfect solution. And sometimes, going back to the point on speed, sometimes we need to take action, and we might make a mistake along the way, but we learn from that and we refine what we're doing and make it better. But sort of moving forward versus stagnating in one place during contexts like this, I think is also important to keep in mind.
Indeed, thank you very much. I have a question here. What should be the priorities now, knowing that people with and without NCDs had their health impacted by COVID, like obesity prevalence, high blood glucose? Will countries be able to economically deal with the burden of this disease and the potential increase in the prevalence of the complications? Dr. Bolton?
I'm not a politician. Well, I guess I am, sort of. First of all, as I said, prevention is cheaper than cure, because there is no cure if you get some of the late complications. And I think one has to realize that people with diabetes can do a lot for themselves whilst at home. For example, during COVID, we brought in, as you were saying, we need to move forward and learn new ways, Dr. Batt was saying, and we are doing that. We're having teleconversation consultations, video consultations, and even Zoom consultations, and much can be done there, apart from obviously a clinical examination. So we're doing a lot there with little expense. And many of our consultations now are on telephone. Obviously, in my area, we can't do that in complications. So we are doing a lot. And we're also looking at medicine supplies chains. The IDF is looking at this in countries that are in difficulty at the moment, such as, for example, Armenia and Azerbaijan. There's a conflict there, and problems in the Middle East, especially Lebanon, Syria, and Venezuela. So there are problems, and the IDF is aware and is being active in this area. But people with diabetes can do a lot, and social media is helping. They can contact free of charge by WhatsApp and discuss how they're managing, how they're coping. So these are all impactful in the management of people with diabetes.
Dr. Bolton, I think there is another question for you. I'm going to read it. COVID has confined people into homes into homes more than ever before, with stressful mental and physical conditions, especially for patients with diabetes whose medications requirements have also changed drastically. What are the IDF recommendations to remain physically and mentally active for such patients and manage medications adherence efficiently?
Well, of course, IDF has been emphasizing this through, we've done a lot of packages, and we have a website specifically for COVID, helping people with diabetes with the answer to questions such as these. For example, now there's many TV programs, keep fit at home without going out. And you don't need a lot of space. So moderate exercise can be done in this way. Diets, look at what's happening here in the UK. We've got a second spike of, as you know, of COVID as other countries, the United States. Belgium is particularly bad. And a lot of this has been the students coming back to university. Even the students are complaining that the food that's being delivered to them is not healthy. Now, I thought students survived on Coca-Cola and probably beer, actually, more likely, and hamburgers. But if they're complaining, then our people with diabetes, I think they've got probably more sense than students and are eating more sensible food, but that's not always easy to get. So supply chains are very important, also for medications in developing countries.
Sure, thank you. The address those issues are multi-sectoral actions that cannot be done by one sector or one stakeholder alone. Another question for Eduardo Nilsson. How do you view the impact of obesity as an underlying factor for diabetes and heart disease, and the role of public and private sector in tackling its growth in all the world?
Yeah, that's absolutely right. I mean, obesity is a major problem. There was the front page of British Medical Journal, I think about 10 years ago, obesity, an epidemic without a cure, an epidemic without a treatment. So the important is prevention. As I said, looking at new cities. Now, Brasilia is a great example of a city that was built to be a capital. And there are cycle paths, there is walking is possible. So and look at the Netherlands. Their prevalence of diabetes is relatively low. They have cycle paths that take priority. And the motorist is the most impeded in terms of speed. So I think we need to look not only at diet, but also town and country planning and planning for the future. And buildings that encourage using the stairs and not the lift or the elevator. All these minor things. You know, when I was working in Miami, I was watching this video and it says, whatever you do, if you have diabetes, use the stairs, don't use the elevator. Until I pointed out to the person who made the film, have you ever tried to use the stairs? Because you can't go on any floor apart from the first floor. So they changed the video. But this is an example. You know, we have to have education that's realistic and it is going to be embraced by people, not that's impossible to follow. So that's absolutely vital. Exercise. You don't have to go to the gym. The diabetes prevention program in the USA showed that 45 minutes of walking around Central Park, for example, a day was good exercise. So people think I have to go and do weights in the gym. You don't have to do that. Walking is a very good exercise and simple diet. Now, some people say the good diet's more expensive, which is probably true. So that we need to take that into account as well in terms of taxing foods and pricing. And I mentioned that in sugar taxes, for example.
Mm-hmm. Mm-hmm. Indeed. Thank you very much, Dr. Bolton. Any final remarks from Dr. Bath and Len before we close this session?
Well, I was just going to add very quickly to that last question. I think it's policy level change for broad population impact is something important that both the public and private sector sort of need to work towards. I talked about, policies like taxation, which Dr. Bolton mentioned, but I think also the private sector and the food and beverage industry recognizing that there are certain foods that really create more problems than others, and sort of taking steps to recognize that and provide healthier alternatives, because it's not just about eating well. It's what do we have access to when we walk outside our door and go down the street to buy something. We need to make our default options the healthier options, and that comes from a policy level, but also from industry themselves sort of deciding, what, we're going to offer this option, not the other one. And retail stores putting in the front of the store when you pay healthy options versus the packaged products. So it's on a multiple different levels. And we know that for obesity and for diet is really the most important factor. Genetics, exercise are also very important, but that diet that we have, we want to make that healthy diet our default and less expensive, because it's true. Currently, it in many places, a healthy diet is the more expensive diet. So just wanted to highlight that.
Thank you very much for your final remarks. Dr. Ba, any final remarks?
Sure. As I'm listening to all of this, and frankly, as I'm watching a blizzard unfold in Minnesota in
Oh.
October, winter
Not
is
in San
coming.
Pablo.
Winter is coming. And so with all of that, as we're talking about staying active, being seen, we have to acknowledge again that the world we're in today is so dramatically different. And that at the end of the day, every one of us has to engage in some form of behavior change, and that is hard. And I think we can individually, each of us, acknowledge that as I stay seated here most of the day. And that is everything from getting up and moving, each of us, all the way through to being seen for a policy change to happen. And so, I think we just have to come back to each of us individually and really taking on board what is it that we will change. And I'll leave on just a quote that has inspired me a lot this year. And it's from Kasturba Gandhi, who is Gandhi's wife. Where I stand is just as important as what I stand for. So to sit and discuss all of this is important, but to be seen is equally important. And I think that's part of what this entire conversation has been about in terms of making sure we're all being seen. So thank you for the discussion.
That's a very good way to end our session. I just want to congratulate you all. Thank you very much for giving us the time. It was very easy for me to moderate this panel. It's a great lineup of speakers. Thank you, Mark, again for the opportunity, and I wish you all a great debate. Thank you.
Thank you.
Thank you.
Bye.
Thank you very much, Katya, Andrew, Shuya, and Porvi. It was a very nice, beautiful discussion, and so important for us to consider the international perspectives in order, to make the right decisions here in Brazil and obviously in other countries as well. So thank you very much.